Welcome to This Explainer, where we're diving into a pretty fascinating medical mystery. Today we're asking a bold question. Could a centuries-old, incredibly sticky Japanese breakfast dish really hold the secret to managing cardiovascular disease? I know, it sounds a bit like folklore, right? But trust me, the clinical data behind this is absolutely staggering.
So, let's dive right in and demystify the science here. We're going to unpack the biology of a powerful biological clot buster, look at the hard clinical data, and expose what we're calling the dosage gap in the supplement industry surrounding a compound called nattokinase.
Here's our roadmap for today. First, we'll look at the cardiovascular fibrin threat. Then meet the enzyme itself, nattokinase. After that, we'll cover the fibrinolysis mechanism, hit that dosage plot twist, compare lumbrokinase and alternatives, and finally, wrap up with safety and best practices.
All right, starting off with Section 1, the cardiovascular fibrin threat. To really understand the solution, we first have to understand the specific threat lurking inside our blood vessels.
And that threat is fibrin. So, what is it? Fibrin is basically the primary structural protein that forms a biological net in your blood. When we need to stop bleeding, this net is a lifesaver, literally. It holds blood clots together. But as we age or face cardiovascular challenges, our natural ability to break this net down kind of slows down. That's when thrombi, or blood clots, start to develop. They're maintained by this gradual accumulation of excess fibrin strands, forming a physical net inside your arteries and veins that actually contributes to atherosclerotic plaque and can lead to heart attacks and strokes.
Moving right along to Section 2, meet the enzyme nattokinase. This is where a traditional food provides a fascinating, natural counterattack to that fibrin net.
Enter nattokinase. Back in 1987, a researcher named Dr. Sumi made a massive discovery. He was testing over 200 different foods to see if any of them had clot-dissolving properties. Well, when he tested natto, which is this traditional Japanese dish made of fermented soybeans, the results were just phenomenal. He found that during the fermentation process, using a specific bacteria called Bacillus subtilis natto, a highly potent, heat-stable enzyme is produced. This enzyme is a serine protease. Basically, that means its specific biological job in life is to break down proteins.
Which brings us to Section 3, the fibrinolysis mechanism. The crucial point here is understanding exactly how this enzyme acts as a biological clot buster right at the cellular level. This image right here brilliantly illustrates the enzyme's raw power in an actual in vitro experiment. Notice the nattokinase, that's the N, placed on a fibrin plate right next to standard medical enzymes used for treating clots, like urokinase and plasmin. Do you see that massive dark halo? That's where the nattokinase has literally eaten away and dissolved the fibrin net. I mean, it's an absolutely incredible visual proof of concept. Now, inside your body, this builds into a really comprehensive three-pronged attack. Step 1. Nattokinase directly attacks and lysis, or breaks down, the fibrin strands all by itself. Step 2. It changes pro-urokinase into urokinase, which activates another clot-dissolving pathway. And Step 3, it increases tissue plasminogen activator, or TPA. So what does this all mean? It means it's not just breaking down the clot directly, it's literally signaling your body's own natural clot-dissolving mechanisms to kick into high gear.
Okay, Section 4, the dosage plot twist. And folks, here is where the story takes a massive turn. We're going to reveal a critical gap between what works in biology and what you actually end up buying on a store shelf.
I really want you to remember this specific number, 10,800 FU. FU stands for fibrinolytic units. That's just how we measure the enzymatic strength of nattokinase. According to the most robust clinical research we have, 10,800 FU is the exact clinically effective daily dose required for true lipid management, cardiovascular support, and atherosclerosis protection.
But take a look at this. The market standard for nattokinase supplements, the bottles you typically see lining the aisles in stores, is usually just 2,000 FU. Notice how drastically lower that is than our clinically effective dose of 10,800. This means most supplements out there are delivering less than 1/5 of what your body actually needs to see major lipid improvements. Even if you step it up to 3,600 FU, the data shows it's just not enough.
And how do we know this for sure? Well, this landmark 2022 mega trial by Chen and colleagues really spells it out. They looked at 1,062 participants over a full 12 months. The outcomes? Completely black and white. The group taking the full 10,800 FU saw significant reductions in atherosclerotic plaque and improved lipid profiles. But the group taking 3,600 FU, absolutely nothing happened to their lipids.
This scientifically confirms that lower doses simply do not work for comprehensive cardiovascular support. You really have to hit that clinical threshold.
And if that wasn't enough proof, a sweeping 2023 systematic review and meta-analysis by Lee and colleagues backed this up perfectly. They concluded, unequivocally, that low-dose nattokinase supplementation has no significant lipid-lowering effect, proving once again that potency isn't just a fancy marketing term, it is the absolute deciding factor in whether this enzyme is actually going to work in your body.
Let's move to Section 5, Lumbrokinase and alternatives. Because dosing and sourcing are just so vital here, let's compare nattokinase against its primary alternative in the natural clot-busting space.
You might have actually heard of lumbrokinase. Now, while both are natural fibrinolytic agents measured in FU, they come from very different places. Nattokinase is a single plant-based serine protease enzyme derived from fermented soybeans, or sometimes chickpeas if you need a soy-free option. Lumbrokinase, on the other hand, is an extract derived from earthworms, and it's a complex mixture of several enzymes. Nattokinase boasts a massive amount of human clinical data for broad cardiovascular factors like blood pressure and lipids. Lumbrokinase is a bit different. It's more frequently studied for specific, targeted post-stroke contexts. Both are super fascinating, but nattokinase is far more established for daily cardiovascular maintenance.
Finally, Section 6, Safety and Best Practices. Before you rush out to find a high-dose, clinical-grade supplement, there are a few very strict, evidence-based safety protocols you absolutely need to know.
Because this is such a powerful biological clot buster, it is absolutely imperative that you do not mix it with prescription blood thinners like warfarin or heparin without strict medical supervision. You also need to stop taking it at least 2 weeks before any kind of surgery. Also, keep in mind that natto naturally contains high amounts of vitamin K2, which actually promotes blood clotting. That's the exact opposite of what we're going for here. So you have to make sure the manufacturer has safely removed the vitamin K2 from the extract. And lastly, it should be completely avoided if you have a history of ischemic stroke or any active bleeding disorders.
Ultimately, your biggest takeaway when evaluating a product should be to look purely at the fibrinolytic units, the FU, on the label. Never just look at the milligrams. Milligrams only tell you the physical weight of the powder in the capsule. They tell you absolutely nothing about the vital enzymatic activity. You always want to calculate the total FU per daily serving to make sure you're getting close to that 10,800 FU benchmark.
We hope this explainer has empowered you with the data to ask yourself a really important question. Knowing the extreme gap between clinical science and the supplement aisle, are your current heart health supplements actually giving you a biologically active dose or just an expensive placebo? Check your labels, demand the clinical dose, and take charge of your cardiovascular health. Thanks so much for joining me on this deep dive.